My name is Shaji Kumar. I'm a professor of medicine at Mayo Clinic in Rochester, Minnesota. Treatment of multiple myeloma has really changed over the past 10 to 15 years. Now, two classes of drugs have been critical in improving the survival of patients with multiple myeloma. One of them is proteasome inhibitor, the other one is immunomodulatory drug. Now, among the proteasome inhibitors, the very first drug that was introduced into the clinic was Velcade or bortezomib. More recently, carfilzomib or Kyprolis has also been approved for use in patients with multiple myeloma. Now, one of the problems that we face with using the proteasome inhibitor class has been that it needs to be administered either intravenously or subcutaneously, considering that the proteasome inhibitor class of drug is critical in the various combinations of drugs that we use for myeloma. The search has been ongoing to try and develop a proteasome inhibitor that can be given as a pill. So the Ixazomib represents the very first proteasome inhibitor that has entered the clinical trials that is orally bioavailable. Basically, you can take one pill once or twice a week. So the clinical trial that was presented was looking at the combination of Ixazomib with lenalidomide and dexamethasone. Now, it builds upon the success of the combination of bortezomib, lenalidomide, dexamethasone, which is one of the most effective regimens that we currently have for treating multiple myeloma. We were able to demonstrate that this was highly efficacious. 90% of the patients had a response to the treatment. 60% of the patients actually had a very good partial response, meaning deeper responses. Combination was quite efficacious, but at the same time it was also very well tolerated. In addition to just looking at the efficacy of the combination, we also wanted to explore the possibility of giving the Ixazomib for a longer period of time, since the treatment paradigm in myeloma is again changing towards more prolonged therapies. So these patients were able to go on Ixazomib once a week for 3 weeks and 1 week off until the myeloma came back, and 21 of the 50 patients in the phase 2 portion elected to do so. Those patients tolerated the medication very well. We did not see a significant number of additional side effects while they continued on this treatment, but at the same time we did see some deepening of the responses. Half of the patients who already were in a very good partial response deepened the response to either a complete response or a stringent complete response. Of course, these results have to be confirmed in phase 3 trials, and these trials are currently ongoing. We need to wait for those results to come out before we incorporate this drug into the routine treatment paradigm, but clearly these combinations appear to be quite promising.